So with blood flow restriction, like the first thing you want to do is make sure that you get the okay from sports medicine, from your athletic trainer, because you don't want to have any contraindications, the reason why you couldn't use it. So always get the A-OK for that first. Then when you come in, you always want to make sure that you know your limb occlusion pressure, because there's certain percentages that you want to use based on where you're using it, if it's the upper body on the arms or lower body on the thighs. So there's research out there saying that if you go 50% on your arms and then you want to take it to 70, there's no greater benefit that you're going to get from going 70 versus 50. So you always want to use the smallest percentage that you can to get the greatest return on it. With that, even starting at 50, like some people may feel really uncomfortable with that, so use it to tolerance. That's just like kind of your starting points for both your upper body and lower body too. The first one is just called a cell swell protocol, which is mostly more for recovery or for even warming up before competitions or practices. We've used that a couple of times, and it's basically just sitting there with the cuffs on, lower body or upper body, 5 minutes on, sitting at whatever your pressure is, 50% or 80%, and then letting the blood reperfuse through your system by taking it off and allowing 3 to 5 minutes to let that blood kind of circulate back through, and then repeating that cycle 3 to 5 times just based on the time you have it at hand. So that's one of the ways that we specifically with baseball have used that the day after pitchers have thrown, like if we have a starting pitcher on Friday night throw 80 to 100 pitches and we need him to help get that recovery process started, the next day when they come in, they'll sit there and do that cell swell protocol. The other ones that we've used a lot is for training itself. So a lot of times in rehab, you can't do a lot of load. You can use, like say if you have a hamstring strain, you can use the lower body BFR cuffs on there and just do like some low level hip extensions. It's not using a lot of load right there, so you can actually get a good training effect through lower loads. One of the ways that we do that is just through 30 reps, but a very smooth tempo. Like if you're gonna do a squat session, you just do 30. Body weight, you don't have to add any load there. Rest 30 seconds, then another 15 reps, rest 30 seconds, and repeat that 2 more times. So that's what we call a 30, 15, 15, 15. And that's what most of the science and the research and literature has been written on, and that's been validated and confirmed that it actually does have good training effects regarding hypertrophy, some strength, some power, but mostly just to help keep the lower body from, or any part that you're using it on, to atrophy and just keep that training stimulus high. The last one that we can use it with is for some aerobic training effects too. So throwing the BFR cuffs on your legs, doing like a light bike or a sled push or pull or something like that, that you can really get a good aerobic effect. Just making sure that you have something, some biofeedback through like a heart rate monitor to make sure you're staying within the aerobic zones. If you don't have that, then you just want to make sure that you can easily have a conversation with someone sitting next to you and that you're not getting out of breath or getting too high into a more anaerobic zone. So those are really ways that we've kind of utilized it with our sports and how we use it to help either with rehab or just to enhance training, just make sure that you're doing the best you can on the field.